Good evening. This is Dr. John Bennett in Miami, Florida for Larkin Hospital TV. Tonight, we have the pleasure of having Benham, dermatologist from Santa Monica, California, who's going to talk about his dermatology app, the Derm Check App. And we also have with us tonight a gentleman who just came fresh in from Tennessee. He's going to introduce himself. Hello, Shajish.
Hi, hello. Hi, John. How are you? And thanks a lot for having me on the panel. And really nice to meet Ben. And really excited to hear about the new app. And very welcome to this Larkin TV program, Ben.
Very good. Shajish is an ENT. I'm sorry, a head and neck surgeon originally from Pakistan. He's teaching at Larkin Hospital, one of the schools associated with Larkin. So welcome, Ben. The show is all yours. Go ahead.
Well, thank you so much. It's my pleasure to be on this show, and thank you for the invitation. Just want to say hello from the beautiful Santa Monica, California. And basically, I'm just going to give a simple introduction about the app. So I'm a dermatologist out here. I've been practicing for almost 6 years. And we basically had the inspiration for this app because several years ago, I had a patient who was from Fresno. He was this young kid, and basically by the time he came and saw me for his mole, unfortunately, it had become a little bit too advanced. So we realized that there are no dermatologists in Fresno. So if there were any opportunities for him to see a doctor earlier, the skin cancer would have not been as advanced as when I saw it. So we came up with the technology where patients can just download an app and at the pleasure of their own home, take pictures of moles or take pictures of their acne or eczema and answer a few questions and basically submit it to a dermatologist. So we've created a platform where it connects patients with dermatologists, and it saves them time, it saves them money. They don't have to go to a doctor office, wait there for an hour, pay for parking. So it eliminates basically a lot of those factors, and it makes the system a lot more efficient.
Very good. Ben, were you always, you didn't write the app, right? Do you have a programmer that wrote the app, or?
Yes, we actually have multiple programmers. We have one person that only does the website, we have one person that does the app for Apple, and we have another person that does the app for the Google Play Store. So we have multiple different programmers basically that have built the app. Unfortunately, I don't have the programming skills, but I come up with the inspiration and basically of how to make the app perfect and simple so that anybody could use it.
Have you always had an interest in computers? Or you use a computer a lot?
Yes, I've always been very tech savvy. I love computers. I actually taught myself how to write web page codes back in mid-1990s. And back before, anybody had email, I was setting my friends up with email accounts. So I've always been interested in tech. I love it. In fact, in my own practice in Santa Monica, we are purely paperless. Everything is electronic records, and there's all computers and iPads everywhere. So, and I took that aspect and I incorporated a lot of it basically into the app that we currently have.
Very good. Okay, why don't we go through your website, Ben, and then after Shajish and I will ask you some questions. And
Sure.
just let me know when you want me to change your page or whatever.
Sure, of course. So, so this is currently our doctors page. So we have listed about several of our doctors. That's me right there with a brief description. That's Dr. Soden from Maryland. And the first couple ones are from California. That's Dr. Gasri. So basically what it is that right now we have enough doctors that we could go live in 16 states in the United States, but we haven't gone national yet. we really want to keep it to California for now. We do have the chairman of UC Irvine Dermatology that sit on an advisory board. We have clinical professors from UCSF that also sit on an advisory board. The rest of the doctors, basically, they're just from other states like Pennsylvania, Florida, Miami. So those are basically a lot of East Coast, like New Mexico, and basically every day we bring on more doctors in the system because physicians realize that's a very efficient system of seeing patients, just like the patients realize that's a very efficient system of seeing a dermatologist. So yeah, so that's the doctor's page, and if you don't mind, actually, you could go to the home page, and maybe we could explain the home page a little bit.
Okay, the home page. Okay, let me just go
Click
here.
Derm Check.
About page. Let me go to the regular page here. Okay.
Yeah, so basically our homepage, we try to explain everything all in one page. If you need to see a dermatologist, you don't have to go and wait in the waiting room for an hour just to get a prescription for your acne. You could just use the app to see a dermatologist. As simple as that. Our message is very clear. We have several reviews basically down there, and let's go scroll down a little bit more and I will explain some of the other stuff. So basically how it works is that the patient downloads the app either on the App Store or on the Google Store. They register, and for example with acne, they just click on the acne tab, take a couple pictures as prompted, and then they just have to answer 2 simple pages of questions, asking about their like general history, like allergies, as well as specifically about their acne, and then they just submit it to a dermatologist. Again, we believe that it's a very easy system. It's cost effective because, first of all, there aren't a lot of dermatologists in the country. There are only 3 dermatologists for every 100,000 individuals in the US.
Oh.
That means to go see a dermatologist, the average waiting time is between 18 to 28 days. With this app, you get to see a dermatologist and you get a treatment plan back within 24 hours. Also, to see a dermatologist, you know, dermatologists are subspecialists. They're expensive. An average copay is now running between $40 to $60. Right now, with this app, the entire visit is just $40. So we have made the system efficient. We have increased access to dermatologists and reduced the gap. I mean, 3 out of every 100,000. 3 people, there are 3 dermatologists for every 100,000 individuals. That's not enough access. There's a huge gap to see a dermatologist. So we're bridging that gap and giving people access, and that's what we're really doing.
Okay.
Currently, so if you scroll down a little bit more, those are all of our doctors across the country. That's a nice map. We're constantly adding more and more doctors. Again, we are waiting to go national in October. That's when we're going to have about doctors in 25 states. With respect to some of the conditions that we treat, we currently treat the most 9 common conditions in dermatology, and this basically includes acne, which is very common. This includes male pattern hair loss, which is very common, cold sores, eczema, psoriasis, rosacea, which is very common, and the other ones that we're going to introduce, we will be introducing toenail fungus, we're introducing insect bite, as well as athlete's foot. So our goal is to treat the most common skin conditions that we could treat easily with teledermatology or telemedicine.
Okay. Okay. Did you have to get FDA approved for this, Ben, or no?
Well, we do not need FDA approval because the system is not reading your mole or is not analyzing your skin. What it is, it's just a platform that takes your information and sends it to a dermatologist. And it's the dermatologist that's really doing all the work. So the answer is no, we do not need an FDA approval because we are not a medical device.
Okay. Now, there's no HIPAA issues, correct?
Well, we are very HIPAA compliant. I mean, we are very secure. We have firewalls on the system. Basically, when the patient takes the photos at their end and submits it, as soon as they submit it, basically everything gets encrypted. And then it goes to our back end and it gets encrypted again. So we have two forms of encryption. So if you look on the website all the way where basically where the web address is, you see that there's a green light that's highlighted, and the green indicates that we have the most secure SSL certificate that's possible. So we have firewall, we have SSL certificates, we have encryptions. So we actually put a lot into security. For us, that is one of the most important things, being HIPAA compliant and being secure.
Now, HIPAA compliant, this is kind of a question about HIPAA. You just kind of have to say you are, or do they actually, does the HIPAA organization analyze your app to see if it is?
Well, there's nobody that's going to analyze our app. I mean, we want to have the best, most secure app out there. So in order to make it HIPAA compliant, you have to have very good security and also the appropriate consents. So for example, in order to provide telemedicine services, the patient has to give you a specific telemedicine consent. And all of that basically leads into this being HIPAA compliant.
Okay. Shajish, you have any questions?
Okay, let me just put it on. Okay, can you hear me, John?
Yes, we can hear you.
All right, okay. Oh, hi, Ben. Yeah, that was wonderful. Really, it's something which has caught my imagination. The only question I have is, like, say, suppose I have a problem and I put a note on the app with a picture and all. How do I know who is going to read it? I mean, who is going to pick it up?
That is a very good question. So basically, when the patient takes the pictures and they fill out the questions, there are two more steps they have to do. One is pick their pharmacy through the app, because we are connected to over 90,000 pharmacies in the U.S.
Okay.
They have to pick their doctors. So the last screen is a page of doctors. So it's very similar to Yelp. Let's say when you put in dermatologist in Yelp, there are 5, 6, 7 doctors that show up. We're the same thing. 5, 6, 7 doctors, however many there are in your state, will show up, and based upon their reviews and how many years that they've been in practice, you choose which doctor you want them to read and evaluate your skin condition.
Oh, okay.
Full control. Then once you select them, then basically it's a dermatologist, and you get a response back within 24 hours.
Oh, okay. So you select, the patient selects the doctor.
The patient selects. We are trying to give the power to the patient.
Oh, okay.
And we're trying to make this process as simple as possible and as efficient as possible. So yes, so the patient has the power to choose who they want. And now let's say that you choose a doctor, and when you come back for follow-up, you don't want to choose the same doctor. The system will give you more options. You could choose either the doctor that you chose last time or pick another doctor.
Oh, okay. And suppose, you know, if you think it's a suspicious lesion, would the patient get a preference in the appointment?
No. What happens is that then the doctor advises the patient to either come to their clinic for like a biopsy, or sometimes the patient is using the app where there are no dermatologists. And our recommendation is that the doctor is going to advise them to go see it, like even a regular doctor in their community, to have that mole removed.
Oh, okay.
So obviously we are trying to just give more access to patients. Remember that story that that's totally at the beginning that happened a couple of years ago with one of my patients who was from Fresno. The reason he never had it removed was because he never had a dermatologist look at it.
Yeah.
But if he had a doctor, just a dermatologist look at it and say, look, that's bad, go to any doctor, go to your family practice doctor and have it removed, then he would have done it. So, and that's what we're trying to do, just to bridge the gap and give people access. So, but look, if they need to come in, we always tell them, look, you need to go in basically right away. And I tell you, initially when we started this app, we were in beta test for over 7 months. And our beta testing was with moles. And I'll tell you, I have diagnosed countless melanomas and basal cell skin cancers on this app. And I'm proud to say that basically we've done it. We're very proud of that. We came out of beta testing in July of 2015, about 6 weeks ago, and one of our main fortes has been really acne. And in about 6 weeks, we have gotten over 8,000 downloads, and we've done over 1,000 consultations. A lot of them just being basically acne, mainly around the California area.
I see. All right. Okay. Yeah. Really, really, it takes off all the, the unnecessary travel, all the expenses. Yeah. This is wonderful. Thanks.
Oh, you're welcome. And one other thing that we're going to do is that, so right now they see the doctor via the app. We're actually in contract talks with one of the largest pharmacies in the U.S. and that they don't even have to go to the pharmacy. The patient's going to get brand name medication at very cheap prices sent to their house. So the benefit is going to be not only they don't have to see a doctor, now they don't have to go even to a pharmacy, and they're getting the best medication, not generics. They're getting the best medication delivered to their home.
Oh, wonderful. Yeah, that's an added advantage.
Yeah, so
that's an added aspect. That's an added aspect of it.
Yes,
not
sir.
the pharmacy.
Exactly. We're trying to leverage our numbers. We're getting a lot of numbers on this on the app. I mean, look, when I started my practice, it took me God knows how many years just to accumulate 1,000 patients. In a matter of 6 weeks, we've had over 1,000 consultations. So we are growing basically beyond my imagination, and we're growing very fast.
Well, just to get back to the logistics, Ben. So the patient sends a picture, and the dermatologist gets back to them within, you said 12 hours, 12 to 24 hours?
24, like about one business day, 24 hours, yes.
Okay, now, how do you get back to them? Do you talk to them or text them or send them an email?
Very good question. So since in order for us to be HIPAA compliant, everything has to be encrypted and secure. So we don't send any emails out. In fact, the patient gets all the information through the app. So when the doctor responds, you get a notification on your cell phone that, look, the doctor has responded. Open the app and read his response. What we try to do was that we want to give a lot of counseling to our patients. So the treatment plan that a doctor sends back is filled with counseling, what to expect, and patient handouts. So for example, when you go to a pharmacy, the pharmacist will give you a lot of handouts regarding your medication. Every time the doctor sends you a message, you will get a prescription medication handout for every drug. So there's a lot of counseling and a lot of education that goes on. I mean, something that honestly in most practices it never happens, but we do it consistently for every patient. So we believe that every patient gets the best quality service from the best dermatologists.
Do you ever get consults from other doctors that kind of ask you, hey, Ben, what's going on with my patient here that I'm treating for heart failure or something?
Well, we don't treat heart failure. Again, a lot of this stuff is basically skin conditions. I mean, a lot of doctors basically on the system know one another, and we've actually tried to come up with the best standard of practices that a couple of us doctors have written, and we're trying to put that on the doctor's side as well. So if the doctor basically has any questions, they could always reference that standard best practices as well.
Okay. Very good. Shajish? Any questions, Shajish?
No. Yeah, this is wonderful. Yeah, it's I just want to say thanks to Ben for being with us and being on the Larkin, TV network. And this is really a wonderful idea. Congratulations in bringing up this idea. And I hope one day this will be, coming into a national level.
Well, thank you so much. I really appreciate it. And if you guys are ever in Santa Monica, California, please stop by the clinic and say hello.
Oh, thank you.
Well, Ben, I'm sure patients love it when you save them time because, you're a young guy, but I'm at the age now where I'm a patient sometimes, and man, oh man, the waiting is terrible. I'm sure patients love that.
No, I agree with you. I mean, the thing is that, I look at my practice and, sometimes patients come in for a simple prescription and like literally, and I always tell myself, we could have done this through the app. I mean, they drove 20 minutes. They paid $15 for parking. Santa Monica is very expensive. By the time they filled out the paperwork, ran the insurance, wait in the lobby. That's another like 10, 20 minutes. So basically, it easily wastes an hour to 2 hours of their time, you know, and if they're only lucky to go see a dermatologist, again, most cities in the United States do not have a dermatologist in those cities. New York, you know, some areas in Florida, Santa Monica were different. We have a lot of dermatologists, but you know, if you go to Fresno, there are barely any dermatologists there.
Very good, Ben. Thank you, Shajit, for coming out, and Ben, thank you for taking the time to present your app, and good luck in the future.
Well, thank you so much, guys. Thank you for having me on the show. Have a beautiful day.
Okay.
Good luck, Ben. Good luck, Ben.
Hang on, Ben. Hang on.
Hold on.
We're going to end the broadcast and we'll talk.